quite well, and you know, realized we both had some mutual areas of interest and that we cared about in terms of prostate cancer. Obviously, he has a more personal relationship with prostate cancer, and my relationship is more obviously as a prostate cancer physician. But you know, that led to a lot of thinking. And when Richard moved to Vancouver, he and Dr. Goldenberg realized there was an opportunity to get some funding from the so-called Specialist Services Committee. This is the Doctors of British Columbia group that was giving seed money to start multidisciplinary programs. And the long and short is we all put together this program, and it started in the beginning of 2013. And over time, it's had other sources of funding, most of them listed here on the slide. But the more recent funding actually came from the Ministry of Health, which was to be used to expand the program across the province. And we chose to do so in the setting of BC Cancer, since that's where all the radiation oncology is for prostate cancer. I should also mention that we've had some very substantial private donations to keep this program alive, because it is a program that's offered to patients completely free of charge. You know, people south of the border think that everything in Canada for healthcare is free, but we all know that's not the case. So, you know, we've had a great history with donors and organizations across Canada and elsewhere. So, as I said, this is a comprehensive program. It's designed to help the patient and his partner really at various time points across the disease. And we now have, the program is based on this framework that consists of 7 what we call modules. And they sort of span from diagnosis towards you know, developing metastatic disease. So at any point where you are in the disease, there's something in our program for you. So the first module is Introduction to Prostate Cancer and Primary Care Treatment Options. The second module is Managing the Impact of Prostate Cancer Treatment on Sexual Function and Intimacy. The third one is a lifestyle approach looking at exercise and nutrition. The fourth module relates to the side effects of androgen deprivation therapy and how these can be minimized. The fifth module is pelvic floor physiotherapy for urinary incontinence. The sixth module is addressing counseling services. And the seventh module is, again, as I said earlier, the advanced disease management. So what happens is, how does someone get into this program? Okay, well, they can either be referred by their provider, or they can be self-referred to the program. Doesn't matter. Ideally, it's at the time of diagnosis, but many patients come in, you know, afterwards as they find out about the program. And we really hope that, you know, over time, we would be able to service any man who is diagnosed with prostate cancer in the province. So the patient registers to participate in the program. Despite the fact this is a free program, you know, not all patients participate in any of the modules, but at least they know it's there. This is why we like to register them, because they may come back at a later time in their disease. We have a site coordinator in Vancouver, but also at each of the sites I'll show you in BC Cancer later on. And the site coordinator has a very important function, really as a navigator. So the site coordinator will take information about the patient, where they're at in their disease, and by, you know, having a conversation, would make suggestions for which modules that person and their partner might be interested in. Again, I told you there's 7 modules. The modules mainly have a group education session that addresses that particular topic. And then the option to be seen in a clinic by that specialized clinician for some, advice that might be very individualized according to that person's issues. If a person is going to go to clinic appointments, we require, although it doesn't happen all the time, but we require that they first attend the appropriate education session beforehand, because a lot of times this can give a person a great background, a better understanding when they walk in to see the clinician. They don't have to ask things that were already reviewed in the education session. We found that to be very successful model. And I think this is a very important part of the program, that the partners are invited to all the sessions. And, in my own practice, I find that having partner there is very useful to me in questioning the person in front of me, because I might ask a question and then I'll look to the partner to see what the real answer is. So it's really important to have partners involved. And in this era of COVID, we now are able to offer all the modules either in person or virtually. And we're still really mainly doing virtual appointments at this time, but even before COVID happened, we were working on virtual access because of the geographic diversity of British Columbia and the fact that not all patients live within a reasonable distance of any of the sites where the program exists. So in the next little bits, I'm just going to go through, give you a flavor of what is talked about in these modules. Actually, all of the modules, or almost all of them, do have tutorials on our website that I showed you in the title page, the title slide. And when, after we go all through this, if you want to ask questions, that's fine. If you want to also just talk about other things, that's fine too. So we like to, I don't want to say capture, but we like to have patients involved from the very time they're diagnosed with prostate cancer. And because, we are operating out of a urology clinic, it's easier for us to have access to those patients, because we find that's a time of very high anxiety, of course, understandably. And we know that the more information we can provide patients, the better they can, proceed and start to deal with the diagnosis and making decisions. Because when somebody's diagnosed with prostate cancer, and you guys can tell me this better than I can, but I mean, your mind kind of goes blank and you can't hear anything. All you're thinking is what you were just told the diagnosis was. So we really try to get patients at that early time to assure them that we have this program that will be there to support them no matter what. So the first module is really a module for the newly diagnosed patients. It talks about the anatomy of prostate cancer and sort of what we call prostate cancer 101, the basics. And that includes the different treatment options for treating early stage prostate cancer. And interestingly, you mentioned SBRT at the beginning. We talk about where SBRT is available in British Columbia, because it is available in British Columbia, it's just not widely available. And in our session in Vancouver, this is unique to us, but We have an individual, maybe 5-minute sessions where a couple can sit down with the urologist and the radiation oncologist at the same time and talk about specific treatment options for them. I mean, just questions they might have about the surgery or the radiation. And we usually have information from the biopsy that's available to the two clinicians to meet with the patient. So that's module 1. Module 2 is the module that deals with sexual function and intimacy. The education session talks about the side effects, the sexual side effects of treatments, whether it be surgery or radiation. Doesn't matter. There's no treatment for prostate cancer that's not going to have an impact on your sexual function. And then how, in the education session, we also talk about how some of these things can be dealt with in terms of erectile dysfunction, some of the treatments for that. And then, you know, other strategies. I mean, penetrative sex is not the only way to have intimacy and sex. So it's just introducing the concept that there are other ways of having a happy sex life even after treatment. The clinic is, the sexual rehab clinic is led by a sexual medicine physician, Ryan Flanagan, who trained at Memorial Sloan Kettering in this area, and recently came to Vancouver. Well, he came back to Vancouver, I should say. He trained at UBC initially, and then did a fellowship in sexual medicine. And then we have a very experienced RN, registered nurse, who trained in sexual health, but she's also spent her last 7 years treating men with prostate cancer and their partners. So highly experienced person. There's different ways now that we can provide the clinic opportunities. You know, in person or virtual. Again, we're not really quite at in person yet, but the virtual clinic, we offer 7 face-to-face visits with the healthcare professional, during which time, you know, different approaches can be taken. There can be instructions for intracavitary injections to improve erectile function, but also many other approaches that don't necessarily involve erections. And that's what these people specialize in. I mean, and I'll tell you what, there's not enough of them. Another option for people who might either live too far away or don't want to do the face-to-face thing on Zoom, there is a clinic called, there's an online tutorial called the Share E-Clinic. This was organized through the group in Toronto, and we do this in partnership with them through funding from the True North program. Again, this also is an online educational tutorial, and will be able to, the student will be able to interact with another healthcare professional, either to message or talk directly with that person. And then, of course, we have the combination. Right now, we're not back to in person, but you know, so there's a variety of ways that this subject can be broached, whatever is comfortable for a person. Then, in terms of lifestyle, we have the exercise clinic and education session. Again, we have certified exercise physiologists who are available for 5 one-on-one sessions to assess sort of baseline fitness levels, exercise needs. You know, if you just had your knee replaced, you know, you're going to be limited by that, but this person will work around that and come up with a so-called exercise prescription that's specified to your particular situation. And then there's various follow-up visits over time. The nutrition clinic, again, the monthly nutrition sessions delivered by registered dietitians, and then one-on-one appointments with the dietitian to specifically deal with an individual's eating habits, their preferences, health conditions that need to be taken into account, et cetera. So again, another personalized approach to nutrition. And then the side effects of androgen deprivation therapy. I mean, not all patients will be interested in this because, of course, maybe they're lucky enough not to need ADT. But if they do, I think Richard and I both feel very strongly about the fact that understanding what to expect before you start, ideally before you start ADT, is crucial to being able to handle the potential side effects that you could encounter. And part of that was Richard's book that deals with the side effects of androgen deprivation therapy, which we give to people who want to have something to refer to. It's a very nice workbook. This clinic is led by a nurse practitioner who actually currently, or in the past at least, has worked with Dr. Chi, and he will deal with specific side effects that might be bothering you in particular that maybe the next guy doesn't have. Pelvic floor physiotherapy, again, this is, an issue that it can be a sensitive issue to talk about. People don't really know what to do about it when they're, a lot of primary care doctors or GPs don't, they just say, oh yeah, do those Kegel exercises. Well, I think we've learned a lot from our physiotherapist that, Kegel exercises, first of all, can be done wrong and actually make things worse. And there are other things that can be taught to a patient to improve continence. And not all patients will improve, but many do. And in fact, there's recently been a paper showing that pelvic floor physiotherapy is effective for improving urinary incontinence after radical prostatectomy. So what makes our clinician very special is that she actually is certified in male pelvic floor rehabilitation, which, not that it should be surprising, but is a little bit different from female pelvic floor rehab. And that, women tend to have a lot more problems with this, mainly because they have babies, and popping babies out, it really can cause a lot of problems down there. So, a lot of the physios who are trained really have concentrated more on women because there are more patients in that category. So the fact that we have a clinician who has the expertise in the male pelvic floor rehab is really quite special. And we actually have invested quite a bit of time in her training other physios in her techniques. So this particular clinic allows 3 physiotherapy sessions in which biofeedback can be used, at least when it's in person. I think we've had some very happy participants in this module. Counseling services, counseling services where somebody actually has an understanding of the disease and some of the things you're facing That's a little unusual. And we worked with a couple in BC Cancer who, for whatever reason, have developed this sort of greater knowledge and understanding of men with prostate cancer. But, you know, there's all kinds of issues that I don't think I have to belabor here, but, you know, they have to do with, you know, fear, loss of control, change in, you know, body image. I mean, so there are those things. And then actually within BC Cancer, counseling services also include some other practical issues, which we don't really offer that in the Vancouver instance of this program, because we would ordinarily refer these kinds of things to social workers. That is, you know, issues about transportation, financial issues, et cetera. Now, these are important things, and that's why they're jointly covered by counseling in BC Cancer. And again, these appointments are for the patient, with or without the partner, or occasionally we will see the partner alone, because we know even though the partner is not the patient, many times the partner is having more issues than the patient, but also trying to keep them sort of inside. So that's a service for everybody. In terms of advanced disease, now this is our most recently added module, and you know, we decided to prioritize early stage disease, which we see more of in the Vancouver Prostate Center, but with interest from our medical oncology colleagues in Victoria, we put together 2 modules that deal with patients with metastatic prostate cancer. And there's 2 different talks. One is regarding hormone-sensitive metastatic disease, and the other is regarding castration-resistant metastatic disease. And right now, this is pretty much offered virtually. We don't have a specific clinic for that because, of course, everybody has their own medical oncologist if they have metastatic disease. So these are the sites where our program is physically located. So up north is Prince George, and then Vancouver, of course, Victoria, and Kelowna. We had a temporary existence in Surrey, but there were a lot of space problems there. So right now our program is mainly offered virtually there. But they are missing, you know, that important site coordinator that helps patients navigate through the system. So it's a little bit there, but it's not fully there. But again, anywhere somebody is in the province, there is access to some way of looking at this program. This is our team in Vancouver celebrating our 7th anniversary.